What is the desired attribute for hard bearing surfaces? Especially bulk material attributes should be biocompatible, corrosion resistant, suitable for metal sensitive patients, and chemically and mechanically stable over extended period of time. But when it comes to bearing surface, you should have a low friction and wettable, so you have less wear, scratch and abrasion resistant, and macro damage resistant like chipping and fracture. What is the choice we have at the moment? We have a cobalt chrome alloy which is worldwide tested and it's been there for ages. Next came a surface hardened cobalt chromium. Next is titanium alloy, ceramic coatings, monolithic ceramium, and last would be zirconium. Oxinium. Now cobalt chrome alloys mainly used in hips and knee prosthesis, corrosion resistant and biocompatibility very excellent. It's a good fatigue resistance and increased tensile strength. Quite difficult to machine, and Vitalium is one of the important alloy. Of course, it has got a nickel, and there are some companies which made iron treated cobalt chromium, not very popular as such. There are some instances where there is no proven record, but there can be a history of allergic issues which can be because of nickel within the alloy, and that can cause a reaction and maybe something like dermatitis. There is no way to prove, but probably allergy testing is not the way to go ahead, and asking the history about wearing ornaments, especially the artificial ornaments, can lead to allergy behind the ears, can be indication that this patient might be sensitive to those things, and that can be the cause for using something else. Now what came next was oxinium, that is oxidized zirconium. It's an oxidized material which causes zirconium and niobium. It forms a hard ceramic surface after being oxidized, and it is very biocompatible with good things. It is used in chemical industries for walls and seal and nuclear fuel rods. Presently we are using for knees and hips. So it is oxidized zirconium which leads to oxinium. Oxinium, that's a standard joint what we've seen from Smith and Nephew. More or less what they claim is they have better scratch resistant, they have better wear characteristics compared to a standard COCR joint, and probably in rotation, and whereas they believe that the wear and tear is lesser. Same thing with Verilast, they have better outcome in terms of wear and tear. Of course, hardness, they claim that oxinium is far harder than the cobalt chromium and so better surface. What we know is it's a ceramic bearing surface without a fracture. It's a surface transformation, no coating. It gives better wettability, more resistant for abrasion and everything, and it can be used very well. But of course, there are papers to claim that the oxinium has not gone any better in terms of results, and the Australian registry has shown that out of 17,000 prostheses, the cumulative percentage revision was more in oxinium component than COCR component. So you should take all those things with a pinch of salt and understand what you want to use and why you want to use. Titanium based alloys like cobalt, chromium and titanium, they are more flexible, lightweight, biocompatible, excellent corrosion resistant. The only thing is they don't have a strength, so you can't use a titanium where you require a lot of strength as such. Now we have a titanium, niobium and nitric oxide treated titanium, which is a very hard surface and what you can call is a gold joint, and they've been recently quite popular. What they claim is they have a better hardened and surface tension. They are better materials than the cobalt chromium in terms of hardness. Surface hardness is better than all the other titanium and oxinium and everything put together. Other metal what is used presently, not for actually implant as such, but is used within the orthopedic fraternity, is a tantalum. It's a trabecular metal composed of carbon substrate with elemental tantalum deposit surface. It's a very good biological scaffold for new bone formation. Its modulus elasticity is closer to bone and better than stainless steel cobalt chrome. It's not been used in implant but can be used as a part of a construct. See, this is a cancerous bone and this is tantalum, very close to similarity between the cancerous bone, and this is used as a very much good scaffold, especially using in the wedges and cones and everything. It is a upcoming thing for thing. It is not used as a process itself but can be used as augments. What you should know about a metal toxicity when you're using in metals: nickel can be cytotoxic and allergen, titanium can lead to osteoclastic activity, and cobalt chrome can lead to a famous metallosis. which you all know and me aware of. But that doesn't mean all the new metals like titanium alloys, oxynium are not scratch resistant. They have their own share of trouble and can be bad as well. So the quest for ideal metal continues, and thank you so much. We have to start from 0 miles sometimes again from Nagpur. Thank you.